Hi, I'm Dr. Eric Heegaard, and I am privileged to be able to talk about how I got to where I am right now. And I am a board-certified gynecologic surgeon, and my focus clinically is mostly in the area of pelvic pain and endometriosis, although I pretty much do the gamut of gynecologic surgery. So I want to talk a little bit about just how I got into this arena of where I am now, because it was not something that 20 years ago I decided, okay, I'm going to be here. And it started basically in its nascent sort of state back when I was training, and I've always been very interested in what we call minimally invasive surgery, which is basically trying to do what they used to do in the old days, which is a big incision in the abdomen. I was always interested in trying to figure out how we can do the same thing with small incisions, and that started almost from the beginning. And so when I got into practice, I did and still continue to do a fair amount of infertility work. And in the process of doing surgery for infertility, I would oftentimes encounter endometriosis. And so it sort of organically grew from that as I became more interested in this patient population and also in how to try to manage this condition of endometriosis without making big incisions and trying to reduce the amount of trauma and discomfort that people have to go through to get this treated. And so it sort of grew out of that. And endometriosis is one of these conditions where I think that depending on the kind of person you are, you can either be intimidated by it and want to just run away from it, or you can kind of get drawn in. And for me personally, this is a condition that just drew me in. And for a couple of reasons. One is the patients are wonderful. They're impressive. They are powerful for the most part. And so I found myself being, over time, more and more kind of enamored by the people who have this condition, because it's for those people who know something about endometriosis who have it and have explored it and researched it, it can take a long time to get proper diagnosis. And in the meantime, people, for the most part, their symptoms have been minimized. They have been told that they're exaggerating. They may have had incomplete or poor surgery or poor treatments and other things like that. And yet I looked at these women and I saw they are living their lives. It's an amazing thing where oftentimes these women they've gone to school, they have their families, they have friendships, they work, and they have pain. And pain that is, for those of us who, I'm kind of on the outside looking in, although I'm more inside than people who don't have it, but it's very obvious to me how much pain these women are having. And to realize that if I know that, and I've said this to my patients before, that if you were to translate the pain that you're having to me, I'd be in the hospital right now. And yet you are working, you're living your life, you're maintaining relationships and friendships and that sort of thing. And if you can't, I think as a provider, if you can't realize how exceptional that group of women, for the most part women, are in terms of just strength, personal strength. And so the more I did it, the more I got invited into the group of women who have this. For many people, and I think for virtually all of it, it is an experiential specialty. The more you do, the more you learn. The more you do, the more people will trust you and come in and see you. And so it has been an evolving sort of area of expertise for me, and has been just incredibly rewarding in so many ways. It's challenging, as I said, or rewarding in the sense of the people you get to work with and who begin to trust you and to be able to work collaboratively. My feeling is I want to work as a team with people. I'm not a top-down sort of guy or provider. Everybody's different. Their conditions are different. And so I like to sit down and come up with a customized way of treating this. But the surgery is incredibly complicated and challenging. And if you like to do surgery, which hopefully most surgeons do, and you're a good surgeon, it is really, in the terms of non-cancer surgery, in terms of gynecology, it is really, there's nothing more challenging in terms of what you might and oftentimes do encounter surgically. And so it really challenges your skills. And then on the other side of it, you have people whose lives are changed by what you do. It doesn't get much better than that. When you feel like you are being invited into somebody's life and you intervene, you work with them, and they feel better.